Welcome. Picture this. You're driving down the highway, squinting super hard, just trying to read a blurry road sign in the distance. But then, you glance down at your dashboard, or maybe look at a book right in front of you, and everything is crystal clear. It's incredibly frustrating, right? Well, today, we're going to break down exactly why that happens.
Have you or maybe your kids ever experienced this exact scenario? You can see the fine print on a page right in front of your nose perfectly, but the trees across the street look like a blurry watercolor painting. You're definitely not alone here. It's a condition affecting millions worldwide, literally changing how we perceive the world around us.
What is myopia? Let's dive right into the medical science behind this.
In medical terms, we call this myopia, or nearsightedness. Basically, it's an eye condition where nearby objects are super clear, but things far away just look blurry. And here's the thing, it's not actually a disease. It's what we call a refractive error. That just means your eye isn't bending or refracting light properly, so the image gets out of focus. But what's actually going on inside the eye to cause this?
Think of your retina like the film in a camera. It's that light-sensitive layer at the very back of your eye. In a normal eye, light comes in and focuses directly onto that retina. But with myopia, the eye's anatomy is just a bit different. Usually, the eyeball itself has grown slightly too long from front to back, or maybe the cornea is just curved too much. Because of this physical change, the light rays end up focusing just in front of the retina instead of right on it. By the time that light actually hits the retina, the image is all scattered. And bam, that's exactly why distant objects look blurry.
Main causes of myopia. Now that we understand the anatomy, let's look at what triggers these changes.
So what's causing this? It's really this crazy mix of our biology and modern lifestyles. Genetics play a huge role. If your parents are nearsighted, there's a very strong chance you will be too. But it's not just DNA. It's all that excessive screen time, reading with the book pressed right up to your nose, and honestly, just not spending enough time outside. Think about it. We spend way more time indoors staring at screens than any generation before us. All that continuous near focus puts a ton of stress on our eyes. Plus, a lack of natural outdoor light, especially for kids, actually increases the risk of the eyeball growing too long. It's kind of a perfect storm.
Common signs and symptoms. How do these internal changes actually show up in daily life? If you're a parent or a teacher, you really want to watch out for certain behavioral cues. The most obvious sign is having trouble seeing distant things, like a student struggling to read the whiteboard. But look for this subtle stuff too, like constant squinting. People squint because it temporarily changes the eye's shape just enough to make things slightly clearer. You might also notice physical effects, frequent headaches after studying, constantly rubbing tired eyes, or a kid sitting way too close to the TV. They aren't trying to be difficult, they're literally just trying to make their blurry world a bit sharper.
Diagnosis methods. Here is what happens when you take the next step and visit the eye clinic. Getting diagnosed is actually a super seamless process. When you visit the clinic, they do a step-by-step evaluation to find your exact prescription. It usually kicks off with a visual acuity test, reading those different sized letters on the chart. Then they use an autorefractometer, which is this really cool piece of tech that automatically gives a baseline reading of how your eye focuses light. Next up is the trial frame, where the doctor swaps different lenses in and out, asking which is clearer, 1 or 2. Finally, they do the final refraction, which locks in the exact lens power needed to shift that focal point perfectly back onto your retina. Treatment and remedies. Let's talk about the modern solutions available to restore clear vision.
Once you're diagnosed, the medical solutions are honestly pretty amazing. The most common and reliable fixes are prescription glasses and contact lenses, but science has come a long way. Have you ever heard of ortho-K lenses? They're special contacts you only wear at night. While you sleep, they gently reshape your cornea so you wake up and can see perfectly all day without any glasses. And for adults looking for a permanent fix, laser surgeries like LASIK or SMILE are incredible options. They precisely reshape the cornea to eliminate that refractive error for good.
Now for kids, the goal isn't just correcting vision, it's stopping it from getting worse. Because children's eyes are still growing, getting them outside every single day is absolutely crucial. Natural daylight actually triggers the release of dopamine in the retina, which is thought to slow down that abnormal eyeball growth. Combine that outdoor play with regular eye checkups, and you can seriously help manage the progression of myopia in kids.
Prevention and precautions. Here are some actionable lifestyle changes to protect your long-term eye health.
Okay, here is a golden rule for fighting screen fatigue, the 20-20-20 rule. It's super simple. Every 20 minutes you spend staring at a screen or doing close-up work, take just 20 seconds to look at something at least 20 feet away. This tiny little habit relaxes the focusing muscles inside your eyes and gives them a much-needed break. It's a total game changer.
Beyond that rule, creating a healthy environment for your eyes is key. Make sure you're always reading or working in adequate lighting so you aren't straining in the dark. Try to limit your phone usage, and when you are scrolling, hold the screen a bit farther away from your face. And seriously, don't wait until your vision is completely blurry. Make regular eye exams a non-negotiable part of your yearly health routine.
Our eyes are incredibly complex and delicate, so please do not try to self-treat any eye problems. Always consult an eye care specialist. If you notice your vision changing or the world getting a bit fuzzy, don't ignore it. Prioritize your long-term health. Ask yourself, when was the last time you saw the beautiful world around you with crystal clear perfection? Isn't it time you took control of your vision?